failure, IF, is a condition characterized by the inability of the gastrointestinal tract to maintain adequate digestion, absorption of nutrients, fluids, and electrolytes necessary for health and growth without supplementation. It can be classified into three types based on duration and cause. Types of intestinal failure. 1. Acute intestinal failure. Typically occurs for a short duration, often due to reversible conditions such as infection, obstruction, or ischemia. Examples: post-surgical ileus, mesenteric ischemia. 2. Chronic intestinal failure, a long-term condition requiring sustained support. Examples: short bowel syndrome, radiation enteritis, Crohn's disease. 3. Chronic progressive intestinal failure, progressive conditions leading to irreversible loss of function. Examples: chronic intestinal pseudoobstruction, motility disorders. Causes of intestinal failure. 1. Short bowel syndrome SBS, most common cause, results from extensive surgical resection. Common etiologies: Crohn's disease, volvulus, trauma. 2. Motility disorders, chronic intestinal pseudoobstruction, scleroderma. 3. Mucosal disease, celiac disease, radiation enteritis. 4. Other causes: enterocutaneous fistula, congenital abnormalities, or bowel ischemia. Management of intestinal failure. 1. Nutritional support, parenteral nutrition, PN, mainstay for severe cases or short bowel syndrome. Provides essential nutrients intravenously when oral enteral feeding is insufficient. Enteral nutrition, EN, encouraged to stimulate intestinal adaptation when feasible, delivered via nasogastric or gastrostomy tubes. 2. Pharmacological treatment, antidiarrheal agents, e.g., loperamide, diphenoxylate. Proton pump inhibitors, PPIs, to reduce gastric acid output. Antibiotics for bacterial overgrowth. Growth factors, e.g., teduglutide, GLP-2 analog to enhance intestinal adaptation. 3. Surgical interventions, intestinal lengthening procedures, e.g., serial transverse enteroplasty, STEP, Bianchi procedure. Small bowel transplantation, considered in patients with irreversible failure or complications from parenteral nutrition. 4. Monitoring and prevention of complications. Metabolic complications, electrolyte imbalances, liver dysfunction from long-term PN. Infection prevention, central line care to prevent catheter-related bloodstream infections. Nutritional monitoring, regular assessment of vitamin, mineral, and caloric intake. 5. Psychosocial support, address mental health challenges and quality of life in chronic cases. Provide education on PN and home care. Key goals of management: minimize dependence on PN by optimizing oral and enteral feeding. Prevent complications associated with PN. Promote intestinal adaptation when possible. Provide individualized, multidisciplinary care.